Good morning. I am Dr. Anju Balaji, professor in the Department of Anatomy, Faculty of Medicine, Sri Lakshmi Narayan Institute of Medical Sciences at Puducherry. It is affiliated under Bharat Institute of Higher Education and Research, Chennai. In today's class, we will discuss a course in anatomy, course code UMB24 ANACT 101. The name of the topic is kidney. The topic is under the abdomen area, which we discuss for the paper 1 of anatomy. So, the kidneys are pair of excretory organ. They share a major part of urinary system. The other organs which help kidney are the kidney, the ureter, urinary bladder, and the urethra. Apart from being the excretory organ, kidney also acts as endocrine organ. The functions of the kidney are first and foremost formation of urine. Along with formation of urine, it also removes all the nitrogenous waste products from blood. It maintains electrolyte and water balance of the body because when the water is consumption is low, the urine formation is done in such a way that the water is conserved. If the water consumption is more, the urine is formed in such a way that the excess water is removed from the body. The electrolytes, mainly sodium, potassium, are also maintained through the function of kidney. It acts as a organ which is secreting the hormone erythropoietin. So this function of kidney as an endocrine organ secreting erythropoietin helps in the maturation of RBCs. It secretes renin, and the renin in itself regulates the blood pressure. The vitamin D, which is a fat soluble vitamin, and this is the only vitamin which can be produced by human body. So in the formation and use of the vitamin D, the kidney secrete 125 hydroxycholecalciferol. This in turn will also regulate the calcium metabolism. Anatomically, when we see kidney as organ in situ in cadaver, the kidneys are reddish brown in color. They are positioned behind the peritoneum, higher up along the posterior abdominal wall. They lie on the either side of vertebral column, which we also call as paravertebral gutter. So they lie between the vertebral column in the midline and the ascending colon on the right side and descending colon on the left side. The surface of the kidney posteriorly is under cover of the costal margin. And also anteriorly, the costal margins cover the kidney surface. The right kidney is at a slightly lower level due to presence of bulkier liver in the right hypochondriac region, whereas the left kidney is at a slightly lower level. The two kidneys, they simultaneously function and they excrete the waste products of metabolism, and that is done by filtration of blood. Now, this waste product removal also control the water and electrolyte balance. This in turn reflects on the acid-base balance, the balance of H plus bicarbonate ions in the blood. The waste products removed by the kidney flow down the ureter into the urinary bladder, and then the urinary bladder contracts during micturition to excrete the urine which is formed and stored in the urinary bladder through the urethra. Now here we see in this diagram the retroperitoneal position of the kidney along the posterior abdominal wall. What we see is the level of the kidney is along the 12th thoracic vertebra till the third lumbar vertebra. So we call it as T12 to L3. The right kidney, as we can see here, is slightly at a lower level as compared to the left kidney. Now, because the kidneys are so closely related to the diaphragm, they also move during the contraction and relaxation of diaphragm, which happens during respiration. So the vertical movement of the kidney is as much as 2.5 centimeter. In this diagram, we see the dome of diaphragm. Here, this is right side, this is left side. On top of kidney, we see suprarenal gland. Vertically running bigger vessels here we see this is inferior vena cava. On left side, this is abdominal aorta. The blood vessels we see reaching the inferior vena cava, the renal vein from either kidney draining into the inferior vena cava. Then we see the gonadal vein of right side draining into the inferior vena cava, whereas the left gonadal vein draining into the left renal vein. We see the branches of abdominal aorta, the celiac trunk, superior mesenteric artery, celiac trunk along with superior mesenteric artery, then the inferior mesenteric artery, the paired renal artery branches. Above that, there are phrenic arteries. Then here, lower down, we see the gonadal artery, again a paired artery, descending down into the pelvis towards the gonad. Then descending from the kidney, posterior to the vein and artery, we see the ureter beginning with the pelvis and descending along the posterior abdominal wall, lying mainly on the psoas major muscle here, and then crossing the larger branches of the abdominal aorta, the common iliac artery, and then the internal iliac artery, then reaching to the urinary bladder in the pelvis. Urinary bladder here we can see is located in the pelvis anterior to the rectum. Okay, and here higher up we see the opening of the diaphragm to allow the passage of esophagus to join with the stomach here in the epigastric region. Okay, so with this we move on to the next diagram. Here we see the dimensions of the kidney. The length of the kidney is to 12 centimeters. The width is 6 centimeters and the breadth or the thickness is around 3 centimeters, which will be variable from person to person. Now, at the hilum of the kidney, which is along the medial border of the kidney, we see the entry of renal artery, exit of renal vein, and the exit of renal pelvis to continue downward as the ureter. The next diagram shows us the quadrants of the abdomen and the position of the transpyloric plane and the transtubercular plane. So here we see the quadrants of the abdomen. So we see that the kidney lies in the epigastric region as well as partly in the left hypochondriac region and the iliac region on either side. So it is related here to the duodenum and the pancreas. Okay, and the hilum of the kidney, the upper level of hilum of the kidney is lying at the level of transpyloric plane. So here we see the vertebral level of the kidney from T12 up to L3, in which again the right kidney is slightly lower and left kidney is slightly higher. Okay. So with this diagram, we move on to the next point, that is shape and dimensions of the kidney. Already we said the kidney is reddish brown in color. The shape is bean shaped. The hilum is directed medially. Now, the length dimensions are 11 by 6 by 3 centimeter. The weight is 150 to 170 grams in male, 130 to 150 grams in female. So left kidney is longer, narrower, and nearer to the vertebral column as compared to the right kidney. Now, the axis of the kidney, so long axis will be directed downwards and laterally, whereas transverse axis is directed backwards and laterally. Now, on the medial border of each kidney, there is a vertical slit, and that is called as hilum of the kidney. The hilum of the kidney, the uppermost part of the hilum of the kidney, is located at the transpyloric plane, whereas the lower part of the hilum of the kidney will be around L2 level. The hilum extends along the large cavity called as renal sinus. Then the hilum is transmitting or giving entry point to renal vein, either one or two branches of renal artery, then the renal pelvis, which will continue as renal ureter. The branches or the locations of the renal artery and the renal vein tributaries and the renal ureter, if we see these structures from anterior to posterior side, then they lie in the fashion as vein, artery, ureter, and then followed by some branches again of the renal artery. Because as we can see in the diagram, the renal artery is giving its segmental branches right before its entry into the hilum. So few branches are entering into the kidney anterior to the ureter, whereas few branches are entering into the kidney at the hilum posterior to the ureter. So in this diagram, we see the superior pole, inferior pole of the kidney, lateral border, medial border. Then we see at the medial border, there is this hilum. Then from anterior to posterior side, we see the renal vein, renal artery, ureter, and posteriorly few branches of renal artery. So ureter is descending downwards along the medial border of the kidney. Now the coverings of the kidney is covered by from within outwards, that is starting from the surface of the kidney to the outside. First, the kidney is covered by a fibrous capsule. As it is a condensation of its own connective tissue, we also call it as true capsule. And this is, as we said, condensation of fibrous stroma of the kidney. It covers the entire kidney. So here in this diagram, we see now in the diagram, this is superior, this is inferior, this is lateral, this is medial. Okay. Now this double line, the white double line, immediately after the substance of the kidney is the true capsule or fibrous capsule of the kidney, that is surrounded by here one yellow layer, the first yellow layer between the green line and the white line. This is the perinephric fat. Peri means surrounding. This is the adipose tissue capsule and it fills the gap between the fibrous capsule and the renal fascia. So renal fascia is separated from the fibrous capsule by the perinephric fat and it also lines the renal sinus at the pelvis of the kidney. Now next we get to the next layer, that is the renal fascia itself, shown here with the green line. It is the condensation of extraperitoneal connective tissue which is surrounding the kidney. So it is given two names along the anterior surface, anterior fascia or fascia of Todt. Along the posterior surface of kidney, we call it as posterior fascia or Zucker-Candles fascia. Then next to this green color line here, the renal fascia, we see another layer of fat or adipose tissue that is abundant and that is called as the paranephric fat. The position of the paranephric fat and the amount of perinephric fat both provide support, nutritional as well as the support against the cold, and the mechanical cushioning to the kidney. So the excessive loss of this fat is injurious to the kidney. A slight trauma can make the kidney vulnerable to the injury from the ribs, which are related to the kidney, or any other external factors. So in this diagram, we see the section of the abdominal cavity. Here this is anterior, this is posterior, superior, and this is inferior. So here we see the kidney positioned here, surrounded by renal capsule, perinephric fat, renal fascia, paranephric fat, then the peritoneal cavity. Here posteriorly, the posterior abdominal wall. Now this is the transverse section of the abdominal cavity. We see the vertebral column. This is anterior, this is posterior, lateral. So we see the posterior abdominal wall muscles, the psoas major, quadratus, psoas major, then the quadratus lumborum. Posteriorly, this is erectus spinae. More laterally, the transversus abdominis. So kidney is related here, covered in renal fascia, perinephric fat, then the renal capsule or renal fascia, and then the paranephric fat. Here we see related to kidney, the colon. So now next we move to the presenting parts of the kidney. So kidney as an organ, when we describe, we say it is being shaped organ which has having two poles. One is upper pole, another is lower pole. There are two surfaces. One is anterior surface, other is posterior surface. They are separated from each other by a medial border which presents with the hilum and the lateral border. So in this diagram, upper pole, lower pole, medial border, lateral border, and we are seeing the anterior surface of the kidney. The vein is cut, so the artery is exposed. So in the diagram, we see inferior vena cava, abdominal aorta, other anterior unpaired branches of the abdominal aorta for foregut, midgut, and then the hindgut. Then we see the suprarenal gland here. So the relations of the kidney on the anterior surface, the right kidney is related to at the upper pole, right suprarenal gland. Then the area of the liver. Now these areas where we see this white membranous structure, the structure that is say liver is separated from the kidney by the peritoneal curve. Whereas when we do not see this particular membrane, that organ is directly related to the surface of the kidney without the intermediate peritoneum, because the duodenum itself is retroperitoneal and kidney is also retroperitoneal. So there is no peritoneum between the descending or the second part of duodenum and the anterior surface of right kidney. Then again we come lower down. There is again right coliflexure without any peritoneum. But the small intestine is separated from the kidney by this peritoneal layer. Now we move to the left kidney. The anterior surface of left kidney at the upper pole is related to left suprarenal gland, separated from by the peritoneum. The kidney is related here to the stomach, then spleen, and the pancreas. This also tells us that the left kidney is one of the structures in the stomach bed area. That is the area of posterior surface of the stomach, which is separating the posterior surface of stomach from the retroperitoneal structures by the lesser side. So this area of the impression of stomach, spleen, and pancreas of the kidney will also be related to the lesser side, whereas the other areas are related to greater side. Now here we see the impression of peritoneum, in itself a retroperitoneal organ, left coliflexure, again a organ without peritoneum, retroperitoneal in position, descending colon, retroperitoneal position, covered by peritoneum, related to the lower pole of the kidney is coils of jejunum. So both the right kidney and left kidney at the lower pole are related to small intestine, whereas at the upper pole both are related to suprarenal vein. On right side, additional relations. Both sides they are related to colon, either the right colon or the left colon. But on right side, the different relation is that of descending part or second part of duodenum. On the left side, the different relationship is with the stomach, spleen, and pancreas. Okay. So with this is common features and the different features, you have to keep that in mind. Now we come to the posterior relations of the kidney. Posteriorly, the kidney is related to the ribs, intercostal muscles, and then to the diaphragm. After that, it is related to the muscles in the posterior abdominal wall. By the lower position of the left kidney, we also see that the rib-wise relationship of right kidney is to, sorry, the lower position of right kidney, the relationship of rib to the right kidney is only for the 12th rib, whereas the left kidney being higher up, it is related to both 11th and 12th rib. So apart from the ribs, it is related to diaphragm in the upper part. Along the lower part, both sides, the relationships are same. Both sides say they are related to from medial to lateral, psoas major, quadratus lumborum, and then the transversus abdominis muscle. So here we are summarizing the relations of right kidney and left kidney. So left kidney is anteriorly related to suprarenal gland, spleen, stomach, pancreas, left colic flexure, and coils of jejunum. Posteriorly, left kidney is related to diaphragm, costodiaphragmatic recess of pleura, 11th and 12th rib, muscles such as psoas major, quadratus lumborum, and transversus abdominis, and the nerves such as the subcostal nerve, that is T12, iliohypogastric and ilioinguinal nerve with root value of L1. Relations of right kidney anteriorly, suprarenal gland, liver, second part of duodenum, and right colic flexure. Posteriorly, it is related to, see the left kidney relations posteriorly exactly same, except for the left kidney is related to 11th and 12th rib, whereas right kidney is related to 12th rib only. Now, when we see the kidney, we also split the kidney with an incision to open up the internal architecture of the kidney. And what we see is called the macroscopic appearance of kidney. That means the appearance of kidney which we see with our naked eyes. Each kidney is having a renal substance and the renal sinus. So these renal sinus are the structures which are related towards the hilum of the kidney. And then we have this renal substance. So renal substance is further divided into. So this part here is renal sinus and this is renal substance. Renal substance is further divided into a medulla and a cortex. So the medulla, here we see the renal pyramid. So these pyramidal shaped structures have 8 to 10 striated pale conical masses, and these pyramids have apex directed towards the renal sinus. This is the apical part and this is the basal part. So these tips or these apical parts are called as the renal papilla, and the base is directed towards the cortex. Now, the lobes of the kidney are divided by these pyramidal shaped structures and they have this adjacent cortex. So, there are many ducts which are beginning from these papillae or these pyramidal shaped structures which open into the renal sinuses. The cortex of the kidney is having pale granular appearance and it consists of renal columns and cortical arches. So these are the renal columns and these are the arches. The renal columns lie between adjacent pyramids, whereas the cortical arches lie at the base of these renal pyramids at the surface of the kidney. So the lobule of the kidney will consist of cortical arch between two interlobular blood vessels. So these are the cortical arch. The renal sinus is having this renal papilla which is surrounded by a minor calyx. So the minor calyx join together to form a major calyx, and these major calyx join with each other to form the renal pelvis, which is this calyx open space. The renal pelvis then exit at the renal hilum and then it continues as the ureter. So in the diagram we see the renal column, pyramid, renal cortex, renal papilla, renal sinus, minor calyx, major calyx, renal pelvis, hilum of the kidney with renal artery, vein, and ureter. Now, the blood supply of the kidney. The kidney is supplied by renal artery, which is a paired lateral branch of abdominal aorta. These renal artery, as they reach the kidney, we can see even before they enter into the substance of the kidney, they divide into segmental branches, which will run anterior as well as posterior to the ureter. Now, once in the kidney, they divide into these interlobar branches, which are going to this adjacent fluid. Then they further continue as arcuate artery. The arcuate artery then forms the afferent arteriole. The afferent arteriole will drain or provide the blood for filtration at the glomerulus. The blood is taken away from the glomerulus by the efferent arteriole. After that, these arterial branches again divide into capillary meshwork, which are along the this descending and ascending limb of the hind leg. So they are running almost vertical to this. So they are called as vasa recta. Then the arterial blood is collected back by interlobular vein, which will then continue as arcuate vein, interlobar vein, and then forming the renal vein. So here in this diagram, we see the arcuate vein, interlobar vein, interlobular vein, then the interlobar vein, then segmental vein, and the renal vein. The renal vein is the tributary of the inferior vena cava. So here we see the artery first dividing into the capillary meshwork, coming as afferent arteriole, leaving as efferent arteriole, and then it is forming a peritubular capillary network and the vasa recta. The lymphatic drainage of kidney is into the lateral aortic lymph nodes. Here we see them positioned along the lateral side of the abdominal aorta. The nerve supply is sympathetic and parasympathetic. Sympathetic supply is derived from preganglionic fibers from T10 to L1 segments of spinal cord. These are vasomotor in function and they supply the juxtaglomerular cells, which will further stimulate the secretion of renin. So this also explains the referred pain felt from the kidney, which pass from loin to groin. Loin supplied at the level of T10, groin supplied by L1. The parasympathetic supply is from the vagus nerve. Developmentally, the kidney develops from intermediate mesoderm in the 5th week of lumbosacral region. So from the 5th week, the development begins in the lumbosacral region. There are two sources. One is ureteric bud, second is metanephric blastema. The ureteric bud forms the collecting part of the kidney, and these are mesonephric ducts near the cloaca, which grow and the buds are formed cranially. Then the ends are dilated and that invades the nephrogenic cord. So the cord forms cap-like structure which is around the dilated end, that is metanephric blastema. The stalk of the bud forms the ureter, whereas the dilated end forms the renal pelvis. After successive division, the major calyx, minor calyx, and the collecting ducts are also formed. So here we see the nephrogenic cord along the posterior abdominal wall, which is forming the mesonephric duct and the mesonephros. Next, we see the metanephric tissue forming the ureteric bud, and further with its subsequent division, it is forming ureter, renal pelvis, major calyx, and minor calyx. Here we see the developmental contribution of pronephros, which disappear, mesonephros and metanephros, which continues. The structures then drain into this cloaca, whose anterior part forms the urinary bladder and also gives rise to primitive urethra. So the metanephric blastema, which is forming the excretory part, is shown here, how it is developing from the metanephric blastema source, which is forming this first the vesicle, which develops into a S-shaped tube, and this S-shaped tube later forms the nephron and is invaded by this afferent artery to form the glomerulus. So the diagram shows the initial nephrons developed from the then the mesonephric, then the metanephric. Then we see here lower down the urogenital sinus and the cloaca. The kidney developmentally develops along the sacral segments. Then it ascends upward. So the diagram shows the gradual ascent of the kidney. So as the abdomen and pelvis grow, the kidney gradually comes from being a pelvic organ to being an abdominal organ. And it is then reaching up to the diaphragm and then comes to be related to the suprarenal gland, which is already developing here. So along this way, it may vary from its path. If it vary from this path, we will call it as ectopic kidney. So as it ascends upward, first it is supplied by pelvic arteries, that is the median sacral artery. Later in the iliac region, it will be supplied by common and internal iliac artery. And then finally, it assumes its blood supply from the renal artery. So with this, we come to the applied anatomy part of the organ. So the kidney is related in these cases or in these patients. So when we see the kidney, we should also remember how it is presenting in the clinical set. That is under applied anatomy. So nephritis is the infection of kidney. It can be acute or chronic. Acute is with shorter duration. The patient will show appearance of edema on face, and there will be excretion of albumin or loss of albumin rather from the urine. When the infection is continuing for a more amount of time, it is called as chronic. And because the kidney is related to secretion of erythropoietin, the chronic infection of kidney will lead to anemia because it is related to renin secretion, which controls blood pressure. Chronic infection of kidney will lead to hypertension. With the chronic infection, size of the kidney will be reduced and it will appear contracted. Now, renal angle is the surface marking of the kidney where we can locate the kidney within the abdominal cavity in a living person. And we will mark it on a mummy in the viva in surface anatomy in the exam. So this angle between the lower border of 12th rib and outer border of erector spinae muscle is marked as renal angle. And it is at the renal angle that we will locate the kidney. The clinical importance of this renal angle is because the kidney is close to this surface, injury at the renal angle will be also involving the kidney. It is a common site where the pain from arising from kidney and tenderness is felt. Also, in case of the renal colic or any pain which is arising most of the times by infection or stone formation in the kidney, we feel the pain at the renal angle. Then, if there is a perinephric abscess, we will first see its signs at the renal angle. So, this is the renal angle, the angle of 12th rib with the outer border of erectospinal muscle. So this angle is renal angle. This angle is renal angle here. The renal calculi or stones or ureteric stones are formed in kidney, may occupy the calyx or the pelvic part of the kidney. They will lead to pain at the renal angle and there can be obstruction to the urine which will further increase the infection and that will lead to hydronephrosis, that is collection of large amount of fluid in the substance of the kidney which will compromise the actual mass or actual working substance of the kidney. Then lithotripsy is for removal of the kidney. Before we try for opening the abdominal cavity and approaching the kidney, we can try to crush the stone and that process is called as lithotripsy. High frequency sound waves are given which will break down the stone into smaller fragments which can be then washed down the urinary system. Hypernechroma is a malignancy of kidney which is quite uh, spreading, quite active and quite uh, distant spread is also seen to the lungs and that will give to cannonball appearance in the X-ray chest. So in this diagram, we see the malignancy of kidney. Here we see the stone formation along the path of the kidney urine. Palpation of kidney should be done in a bimanual position where one hand is placed in front and other hand in the flank. The artificial kidney is same as the hemodialysis or dialysis. And here we are supplementing the function of kidney with this machine which will filter the blood to remove the waste products from the blood. Hydronephrosis is distension of the renal pelvis because there is obstruction of to the urinary flow. Here see the obstruction is there and this renal pelvis is here distended. Then kidney transplant or renal transplant is the procedure which is giving a kidney from donor to the person who is having the damaged kidney. Imaging wise, we need to see the assess the structure of kidney or see the compromise on the function of kidney by visualizing it. We can do the put the dye through the intravenous route which will be filtered through the blood and we can see all the parts of the filtering system. The minor calyces, major calyces, renal pelvis, ureter, urinary bladder and urethra. Sometimes we can put the catheter into the urinary bladder up the ureter and then pass the dye which will be called as the which will be the transurethral pylography and it will not show all these structures in detail because the dye will be just put here and it will be washed out. not secreted from the kidney. So the developmental anomalies can be total renal agenesis, which is 1 in 100 cases. Male are more affected and left kidney is usually absent. It is because the ureteric bud fails to develop on one side. There can be bilateral renal agenesis where both kidneys are not developed. There can be multiple kidneys where there is splitting of ureteric bud. As per the position, the kidney can be just pelvic in position, it has not ascended. Sometimes both kidneys join with each other and they are forming a pan kidney. Here we can see a pan kidney and we see that two ureters are exiting there and these blood vessels are supplying to both the kidneys. According to number we have seen, so here we see these multiple kidneys. Here we see the agenesis first. Kidney is not seen on one side. Then next diagram, we see the multiple kidney. But here we see that the ureters are joining as they carry the urine to the urinary bladder. The horseshoe-shaped kidney, where the lower pole of both kidneys join with each other. And this connecting part, isthmus, will lie in front of aorta and inferior vena cava and may obstruct the both. Then if there is failure to the fusion of excretory and collecting part, as we can assume, the urine will be formed but will not be taken out of the kidney. So here the urine is collected into multiple cysts, so we get a polycystic kidney. And here we see this is actual specimen of kidney which is having these multiple cysts. So sometimes the kidney which is plastered to the posterior abdominal wall will be mobile and that tilting, downward tilting of the kidney will lead to twisting of the renal vessels and the pelvis, and sometimes that will obstruct the blood flow out the flow of the urine. Then we may have a kidney, single kidney with double ureter, which is because of two ureteric buds which have invaded the metanephric blastema. Here we see the normal kidney and then the kidney with two ureters. Here we see the kidney in its abnormal position, which is pelvic position. So these are the different variations in the kidney, both kidneys on one side. Then the ureters are crossing, here the ureters are not crossing. Here again the kidneys are directed in a different way so that the hilum lies on different sides. The kidneys are forming a lump or a pancake. Then they may form a L shape or they form a disc. So all these variations will have implications on the surrounding organ as well as the function of the kidney. So with this, we complete the topic on kidney, prepare it from theory point of view, where you get a long answer question and short note, as well as the practical point of view for both Viva as well as Viva, that is discussion, as well as spotting. Thank you. So we conclude this class now. Best of luck.